So our next speaker, and I think it is the last one, and then we're going into the drawings. So I have spent my career in labor, right? But I also wore a management hat because I was the executive director at M&A and I was a field director before that. And so I have both perspectives on this issue, right, of a benefit, and I've always had a unionized workforce, of like providing this as a benefit and then receiving it as an employee as a benefit. So I got to tell you something, labor and management have a common enemy when it comes to health insurance as a benefit on our balance sheet, either way. And that's why we have to make sure that we have business folks part of this movement. It is critically important, and we are so lucky because we have Kevin Brown, who is here today with us, and Kevin is the owner of Smart Set Incorporated, a graphic design and print company in Northeast Minneapolis. Kevin's a lifelong activist, and while interning at Northern Sun News back in the 1980s, he learned about the potential of printing and design to amplify voices that are often not heard. Starting as the first full-time employee at Smart Set, he took over the company in 1992. Kevin has also served on the boards of Linden Hills Coop, Seward, am I saying that right? Is that right? Neighborhood? Seward, yeah, okay. I'm a St. Paul girl. A neighborhood group, Mississippi River Revival, and Main Street Alliance, amazing Main Street Alliance. After struggling for years to provide health insurance for his employees, Kevin has become a strong single-payer advocate. Let's hear the business side of it after we've heard the conservative. Thanks, Kevin.
Thank you, Rose. I'll be quick. I appreciate the opportunity to speak about the experiences of a small business owner. I'm the owner of Smart Set. We're a 37-year-old graphic design and print shop in Northeast Minneapolis with 5 employees. We're a certified B Corp, a union shop, and members of Main Street Alliance and Metro IBA. For over 3 decades, we provided health insurance for our employees, not because we had to, but because it's the right thing to do. In addition, health benefits are vital to attracting and retaining employees. We pay over $35,000 a year for healthcare coverage for our small group of 5. That works out to $4 for every employee hour worked. Think about it. There's also a deductible of $4,600 per person. To cover their deductible, an employee would have to save more than $2 an hour for every hour that they work just to be able to access their insurance. Most people's insurance isn't going to pay for anything unless you have a catastrophic health event. Paying $6 for every hour worked for healthcare insurance is unsustainable and is bad for business. Small businesses account for half the jobs in the state of Minnesota, but we pay on average 18% more for healthcare compared to large businesses, and even more compared to the largest corporations who can self-fund their coverage and pay benefit managers to cover costs. Why are we seeing the Chamber of Commerce and big corporations fight universal health coverage? Is it because they know that small businesses are paying more than their fair share in a system rigged to benefit the largest employers? Leveling the playing field is vital to growing our local economy since, according to the SBA, companies with less than 20 employees create the most new jobs in Minnesota. A level playing field would be good for business in our state. A 2018 poll conducted before the pandemic by the Small Business Roundtable found a full 31% of respondents marked healthcare as their #1 concern if there was only one issue for Congress to deal with. I spend 20 to 30 hours every year researching options, comparing private plans to the exchange, talking to employees about their needs while trying not to invade their privacy. I'm no expert on health insurance, and I never will be. Why are small business owners expected to bear this burden? This is not good for business. Our current system spends 30% of every dollar on administrative costs. Any entrepreneur could tell you this is no way to operate any venture. Why do we accept this in an industry that is 20% of the entire U.S. economy? This is unsustainable and is not good for business. Universal single-payer healthcare is the only fiscally responsible solution, as we just heard. Medicare for all. This is a totally unprovable claim, but I'm going to make it anyways. Medicare for All would be the biggest boon to small business development in the history of our state. It would allow spouses holding down corporate or public sector jobs just for health benefits to join the family business. It would mean workers could choose a job that they love in small businesses or startup without having to worry about health insurance. Employers could pay employees more, money that would immediately flow into the local economy. No universal health care tax is going to amount to $6 for every employee hour worked. Leveling the playing field would free up capital that small business owners would invest back into their business, spurring local economic growth. Universal health care coverage would allow businesses to hire more full-time employees, making it possible for many Minnesotans to escape the drudgery of having to hold down 2 to 3 part-time jobs just to pay rent. It would also reduce a major barrier for would-be entrepreneurs starting a new business. A study by the RAND Corporation found a large and statistically significant increase in business ownership rates during the month when a worker turns 65 and qualifies for Medicare. How absurd is it that people have to wait until they're 65 in order to pursue their dream of entrepreneurship? The pro-business, pro-employee solution is universal health care, just like the rest of the world figured out many years ago. Our current system is unsustainable any way you look at it. We pay more money for worse outcomes than any country in the world. It's time to build our local economy, support small businesses and their employees by leveling the playing field, removing the burden of employer-based health care, and controlling costs while providing health care for everyone. Thanks.